At some point during our lives, we or someone we love will need blood. In fact, every 2 seconds, someone needs a blood transfusion. To fight cancer, to recover from surgery, to survive a horrible accident. So many of the medical miracles we take for granted would be all but impossible without a safe, dependable blood supply. It's a supply that must be constantly replenished because blood is living tissue and has a short shelf life. There's no substitute. Blood comes from volunteer donors who are encouraged to give several times a year. We all expect blood to be there when we need it, but fewer than 1 in 20 people regularly give blood. When you give blood, you save lives. Volunteers donate at the blood center or at a blood drive at work, school, or church. The entire process takes about an hour from interview to refreshments. Our thorough donor interview covers your current health and medical history. We'll also check your temperature, pulse, blood pressure, and blood iron level. The actual whole blood donation only takes about 10 minutes. While you relax in a comfortable chair, 1 unit, about a pint, of your blood is collected in a special container. The average person has between 8 and 12 pints of blood, so it's easy to spare 1. All materials used in the donation process are sterile and disposable. Once used, they're thrown away. You cannot get AIDS or any other disease by donating blood. After donating, you'll relax in the refreshment area for about 15 minutes. Most donors feel great after they give blood, but occasionally a donor won't. Uncomfortable donor reactions are rare, usually mild, and are most likely to occur in the first few minutes after the donation. It's always a good idea to spend some time in the refreshment area and have something to eat and drink before you head out the door. Samples from your blood donation are tested for the recipient's safety. These tests include screening for HIV and hepatitis and to determine your blood type, A, B, O group, and Rh factor. Most blood donations are separated into components so that one donation may help several patients. The 4 major blood components are red blood cells, plasma, platelets, and cryoprecipitate. Red blood cells may be used for surgery, trauma, and sickle cell patients. They're refrigerated and must be used within 42 days of donation. Plasma for patient use is frozen and can be used up to 1 year after donation. It's most often used after surgery or in trauma situations because it contains clotting factors to help stop bleeding. In addition, plasma can be used to manufacture pharmaceutical products and vaccines, such as those used in the treatment of hemophilia. Platelets are vital for leukemia and other cancer patients. Platelets are very perishable and must be used within just a few days of donation. Stored at room temperature on a constantly moving rack, platelets actually breathe through their special bags. Cryoprecipitate is a concentrate of certain blood clotting proteins that can be used to control massive blood loss in surgery or trauma care. More and more often, component separation is done right in the donor room or at the blood drive. Blood centers can use special machines to collect the donor's blood, keep 1 or more specific components, and return the remaining components to the donor. Whole blood donations, on the other hand, are taken to the blood center laboratory to be separated into components. Each unit and the empty bags attached to it are placed in a centrifuge and spun at various speeds to separate the whole blood into its separate components. A high-speed spin separates red blood cells from plasma, and a softer spin separates red blood cells from plasma and platelets. Red cells are heavier than the other components, so they sink to the bottom of the bag. Using a spring-loaded expressor, the red cells are separated from the plasma, or platelet-rich plasma. The platelet-rich plasma is then returned to the centrifuge for a second spin. Next, platelets are separated from the plasma into their own special bag, again using the expressor. After testing, processing, and labeling, these various components are ready for delivery to hospitals where they're used to save and sustain patients' lives. You'll probably never meet the patients whose lives your donation has touched. Yet you can be sure that they and the people who love them are so grateful. On their behalf, thank you for donating blood, and please make it a habit to give blood several times a year.